All right, Colin. November marks Diabetes Awareness Month, so here to talk to us a little bit about that, Dr. Kateryna Kotlyarevska. Did I get that right?
Yes. Yeah.
To talk more about the condition, more specifically juvenile diabetes. Now, I've mentioned before with doctors that have visited previously, my father had diabetic, but it was adult onset. So I have a question very specific for you that I'll start with. Are my children at an increased risk of that because of the family history now?
There are essentially two main types of diabetes, type 1, which is called juvenile, and type 2, or adult onset. Children are more prevalent to get type 1 diabetes, which is autoimmune disease, and a lot of the families who have type 1 diabetes don't have relatives with type 1 diabetes. Also, there are some family members, parents, or siblings. With type 2 diabetes, it's a more lifestyle, but it's also a genetic element. So we see more genetics, it runs in the families, grandparents, parents, and children. If they don't eat right, if they don't take care of their weight, they are prone to get type 2 diabetes.
What are some of the early risk factors that we should be aware of as parents?
Type 1, type 2?
For juvenile?
For juvenile, yeah. Juvenile is type 1 diabetes, and as I told, it's autoimmune, so essentially there is not much you can do. It's not because kids ate candy for Halloween or, they did something wrong. It's not because, their parents did something wrong. It just happens. With type 2 diabetes, you can definitely do a lot to prevent it, to treat it, and catch it in the early stage. And it's essentially healthy lifestyle, eating right, exercising, take care of your weight.
With type 1 diabetes, are there things that we could see in children that might make us think maybe there is a problem there?
Yeah, very early signs of type 1 diabetes. It's unusual thirst. Kids start to drink a lot, and they typically ask for water. And parents of the younger kids are more observant because, they monitor their bathroom and their drinking patterns, so they can notice it earlier. Teenagers are a little bit more difficult because they're more independent, so it may take a while for the parents to catch it. So drinking a lot, going to pee a lot. Sometimes kids start to wet the bed if they already were toilet trained during the night. And a lot of kids eat more but don't gain weight, starts to lose weight. Treatments,
if your child does end up with this disease?
Type 1 diabetes is requiring insulin for good. They need to monitor blood sugar, give insulin shots. If it's type 2 diabetes, a lot of the time it can be managed by diet, exercise, and oral pills.
Okay, doctor, we appreciate the time again. November is Diabetes Awareness Month. We've given you just a brief kind of glimpse into this disease. If you have any more questions, obviously you don't want to come to someone like me. Always go to someone that has the white coat on. Talk to your physician. Doctor, thank you very much. We appreciate it.